Hello, so let's start the head and neck anatomy, and first we will discuss the skull and its bones. In this session we will discuss the different aspects of the skull and its bones, its bony landmarks and foramina. So this aspect is Norma Frontalis. Okay, the front view, this is Norma Lateralis. Okay, this is the interior view of the bone. This is Norma Verticalis. Okay, externa and interna, internal view and external view. Okay, so in this lecture we will be covering these aspects. Okay, so let's discuss the Norma Frontalis. First we will identify its bones. So this superior most bone is frontal bone. Okay, the frontal bone, and below the frontal bone this and above the opening of the nose, this is the nasal bones. It's two in number, one on each side. Okay, this bone is zygomatic bone. These two are zygomatic bone. Okay, and this bone is maxilla, which form the upper jaw. Okay, and this one is the mandible, which forms the lower jaw. Okay, so these are the bones in the Norma Frontalis. Okay, now we will identify the sutures. So we can see this suture, which is between the frontal bone, and this bone is parietal bone. So the suture between the frontal and parietal bone is coronal suture. Okay, in the new bone, the frontal bone has also connected by suture, which is called metopic suture, but it ossify or it closes at the age of 2 to 6 years. Okay, so in the adult we mostly we can see the metopic sutures, because it disappears at the age of 2 to 6 years. Okay, this suture between the frontal and nasal bone. This one is frontonasal suture. The suture in between the two nasal bones is internasal suture. Okay, between the frontal and zygomatic bone, this is frontozygomatic suture. Okay, so these are the sutures in the fronta Norma Frontalis view. Okay, so we have talked about the metopic suture. This is frontal suture, also called metopic suture, and it get disappear at the age of 2 to 6 years, but sometimes it persists in about 8% of the adults. Okay, so this is the metopic suture in between the two frontal bones. Now the foramina in the Norma Frontalis view, this foramina above the orbit is supraorbital foramen. Okay, supraorbital foramen, and it transmits the supraorbital nerve along with its vessels. Okay, this is the supraorbital foramina. Below the orbit, each orbit, this is the infraorbital foramen. Okay, infraorbital foramen, and it transmits the infraorbital nerve and its vessel. Okay, now this suture, which is in the zygomatic bone, this is zygomatocofacial foramen on each side, one on each side, and it transmits the zygomatocofacial nerve and its vessel. You can see this foramen in the mental foramen. Okay, this is mental foramen, and it transmits the mental nerve with its vessel. Okay, so this is the frontal Norma Frontalis aspect of the skull. Now you can see this prominence or elevation in between the supraciliary arches. These are the supraciliary arches, and in between the two supraciliary arches is this elevation which is called glabella. And the depression in the frontonasal, this is the frontonasal suture, and this depression in the frontonasal suture is called nasion. Okay, so this is nasion. You can see below the nasal bone in the opening of the nose, this is the nasal septum with concha. This is the middle concha, and this is the inferior concave. Okay, so these are the prominences and the foramina in the frontalis view. Now we will go to the Norma Verticalis externa view. This is the Norma Verticalis, and this is Norma Verticalis interna. This is external view and this is internal view. Okay, so first we will identify the bones. This is the frontal bone, this is the two parietal bones, one on each side, and this is the occipital bone, which is most posterior part of the skull, bone of the skull. Okay, then the sutures, this suture which is present between the frontal bone and parietal bones, this is the coronal suture. Okay, this one and this one, these are the coronal suture, while the suture in between two parietal bone, this is called sagittal suture. Now, and this suture which is present between two parietal bones and the one occipital bone, it is called lambdoid suture. Okay, this is lambdoid sutures. Okay, now you can see this point. This is the point where the coronal and sagittal sutures meet. This point is called bregma. Okay, in the adult, but in the newborn it is represented by the interior fontanelle. Okay, interior fontanelle. I will show you the interior fontanelle. This is the interior fontanelle which is represented by bregma in the adult stages. Okay, so this interior fontanelle is diamond shaped opening, or the depression. Okay, you can say it. This is the coronal suture and this is sagittal suture. So the meeting point of these two sutures form the interior fontanelle in the newborn, but in the adult it is represented by bregma. The interior fontanelle closes at the 18 months of age. Okay, so this is the bregma, while this point, which is the meeting point of two one sagittal suture and the lambdoid suture. Okay, this the meeting point, it is called the lambda. Okay, and the lambda is represented by the posterior fontanelle in the newborn. Okay, so this is the posterior fontanelle, and it is triangular in shape and it closes at the age of 6 months. Okay, so the posterior fontanelle is represented by the lambda, while the interior fontanelle is represented by the bregma. Okay, this is the internal view of the Norma Verticalis. Okay, the internal view. One thing that this is foramen in the parietal bone. This is called parietal foramen, and it transmits the imagery veins between the superior sagittal sinus and the scalp vein. Okay, now this is the Norma Verticalis internal view. Okay, this is the frontal bone, two parietal bones, and the posterior most is occipital bone. Okay, this is the coronal suture. Okay, between the frontal and parietal bones. This suture is the sagittal suture. Okay, between the two parietal bones, and between the parietal and occipital bone is lambdoid suture. This is lambdoid suture. Okay, this is bregma. okay, represented by anterior fontanelle in the newborn, and it get ossifies or closes at the 18 months of age, while this is the lambda, the meeting point of sagittal suture and the lambdoid suture, and it closes at the age of 6 months. Okay, now you can see this is the groove for the superior sagittal sinus. Okay, this groove is for the superior sagittal. Okay, so groove for superior sagittal sinus, and these grooves are for branches of middle meningeal artery, while this is called, these are called granular foveolae. Okay, and it is made by arachnoid granulations. Okay, so these are the Norma Verticalis interna. Now we will move toward the Norma Lateralis, lateral view of the skull. Okay, first we will identify the bones. This is from the above, interior to posterior. This is frontal bone, this is parietal bone, this is the suture between the frontal and parietal bone, which is called coronal suture, and this is the posterior most bone is occipital bone, and the suture in between these two bone is lambdoid suture. Okay, now this bone, this is called greater wing of sphenoid bone. Okay, greater wing of sphenoid bone, this is the squamous part of the temporal bone. Okay, this is the squamous part of temporal bone, this is the mastoid process of the temporal bone. Okay, now the suture in between the parietal and temporal bone, this suture is called squamosal suture. Okay, so this suture in between parietal and temporal bone is called squamosal suture, while the suture in between the occipital bone and the mastoid, this suture is called occipitomastoid suture. Okay, this is zygomatic arch. Okay, and this is the zygomatic bone, this is zygomatic-offacial foramen, this is nasal bone. Okay, this is maxillary maxilla, and this is the mandible which forms the lower jaw. Now the sum of the bony landmark, this is H-shape bony landmark or H-shape suture. Okay, this is formed, this is one of the important landmark. This is called Tyrion, and it is formed by the meeting of four bones. This is frontal bone, parietal bone, temporal bone, and greater wing of sphenoid. It forms the suture, H-shaped suture, which is called Tyrion, and in the newborn it is represented by interior-lateral fontanelle, which closes by 3 months of age. Okay, interior-lateral fontanelle or sphenoidal fontanelle, you can see it here. This is the newborn skull, and this is the interior-lateral fontanelle or sphenoidal fontanelle. It forms by the meeting point of four bones: parietal bone, temporal, greater wing of sphenoid, and frontal bone. It get closed by the 3 months of age, and in the adult stage it is represented by this Tyrion. Tyrion is the point which overlies the middle meningeal artery, the interior branch of middle meningeal artery. And clinical importance of this Tyrion landmark is that with there is fracture of Tyrion, so in that case there will be risk of the rupture of the middle meningeal artery and will cause the extradural hematoma. Okay, so this is one of the landmark in the lateral view. Now this landmark is Asterion, and it is made by the meeting point of lambdoid suture and the this suture is what it is called, this is the occipitomastoid suture. Okay, and this suture is called squamosal suture. So the meeting point of these sutures form the landmark which is called asterion, and its importance is that it overlies the sigmoid sinus. Okay, and it is represented by posterior lateral fontanelle in the newborn, and it also just like the pterion, it get ossify or closes at the 3 months of age. So this is the posterior lateral suture, also posterior lateral fontanelle, also called mastoid fontanelle. Okay, and it get closes at the age of 3 months. Okay, so this is the asterion. Now the other landmark is this opening which is called external auditory meatus. Okay, this is the external auditory meatus, and above it you can see this is the triangular area, triangular depression, or you can say it is the triangular area, and this is called submeatal triangle. Okay, suprameatal triangle, and the suprameatal triangle, this landmark forms the lateral wall of the mastoid antrum. Okay, you can see this is the auricular tubercle. Okay, articular tubercle, and this is head of the mandible, and this is the mandibular fossa which forms the temporomandibular joint. Okay, so if we remove the mandible, then behind the mandible there is this fossa. Okay, and there is pterygomaxillary fissure. If we remove this mandible this is pterygomaxillary fissure and pterygopalatine fossa, and this fossa is below the temporal bone. This is infratemporal fossa. Okay, behind the mandible, and this landmark, this is the styloid process. Okay, and in the styloid process there the 3 muscle and 2 ligaments attached to it. The 3 muscle which attaches to it is the stylohyoid muscle, styloglossus muscle, and stylopharyngeus muscle, and the 3 muscle is supplied by different nerve. The stylohyoid muscle is innervated by the facial nerve, the styloglossus by the hypoglossal nerve, and stylopharyngeus muscle is by 9th cranial nerve, while the 2 ligaments which attaches to the styloid process is the stylohyoid ligament and stylomandibular ligament. Okay, so this is the Norma Lateralis. Okay, now we already talk about the fontanelle in the newborn and their location in the adult skull. Okay, so in the newborn there are 4 fontanelle. This is the interior fontanelle in between the coronal suture and the sagittal suture. This is the posterior fontanelle in between the sagittal and lambdoid suture. Okay, the interior fontanelle closes at the age of 18 months, while the posterior fontanelle closes at the age of 6 months. It is represented by bregma in the adult, while the posterior fontanelle is represented by lambda in the adult. While these are 2 interior lateral fontanelle and posterior lateral fontanelle. Interior lateral is also called sphenoidal fontanelle, and it represented the pterion at the adult in the adult skull, while the posterior lateral fontanelle is also called mastoid fontanelle, and it is closed by 3 months of age, and it is represented by the asterion in the adult skull, while the anterior lateral fontanelle also closed by 3 months, and it represented by the pterion in the adult skull.